Hello everyone and welcome to another R&R Partners video. My name is Remus and today we are going to talk about the health insurance in Romania. Now, there are three cases in which you can be insured according to the Romanian law. The first case is automatic, just because you're in a certain position. Second is that you are obliged to be insured, and the third one is that you want to be insured. The first case in which you are insured automatically is when you are employed by a Romanian company. In that case, the employer is obliged according to the law to subtract a portion of your income and send it automatically to the Romanian state. Therefore, a simple declaration by the employer will be enough to show that you are insured in the public health system. The second situation is when you are obliged to be insured according to the law. That means that in a year you receive more than 12 salaries from other activities. For example, you could be buying and selling Bitcoin, or you can be a shareholder in a company and you receive dividends higher than 12 salaries. And the Romanian law states that in this situation, when you receive more than 12 gross salaries per year, you are obliged to pay the health insurance at those 12 minimum wages per year. That means that even if you are doing, for example, €1,000,000 per year from dividends, you will just pay the health insurance at the minimum, and that would be somewhere around €600. The third situation is when you need the health insurance, but you are not obliged to do so according to the law. That means that you either have less than 12 gross salaries or you have no income at all. In that situation, the Romanian law states that you need to go at the fiscal authority, make a declaration and sustain that you want to be insured in the national health system, and you will be obliged to pay a minimum of €300 to be insured in the national health system. In either of the three above mentioned cases, you can ask from the county health authority a proof that you are insured in the national health system. Usually that's given based on the documentation that you submit. Sometimes you do not even need to pay the taxes, you just submit the declaration and you can pay the taxes afterwards, and you are insured from the date from which you submit the declaration, and the authority will give you a paper which states that you are insured in the national health system. With this paper, you can go to a general practitioner. In Romania, it's called a family doctor, doctor de familie, and you can be one of his patients. The general practitioner can prescribe to you medication or refer you to a specialized doctor if you need specialized care. If you are wondering what is a health insurance that the immigration office wants from you, or if you are in the procedure of getting your first residency permit, be aware that for the first residency permit, if you are not employed, you can go with a private health insurance, and afterwards, when you go for a renewal or you want an extension of your stay, or I don't know, you just change your domicile or you want to change your name or you lost your card, be aware that you have to bring a proof that you are insured in the national health system. Therefore, you would need a certificate issued by the county health authority. If you have any questions regarding the procedure or you need help in the procedure at the immigration office, you can ask us for assistance in the procedure. We also do that for our clients, and you can email us at office@rrpb.ro, or you can just pop a question down in the comment section and we will answer as soon as possible. If you found this information helpful, we would appreciate if you give us a like down below. And for more content regarding the legal procedures in Romania, you can subscribe to our channel. We post here regularly and we are trying to help everyone navigate the Romanian legal system as easy as possible. Until next time, See you. Bye.